Hello, welcome back to this channel. This is Dr. Farida Rajan Ibrahim Omasundi, and today we are going to discuss ectopic pregnancy. So if you haven't yet liked this channel, please do like, share and subscribe. So what is an ectopic pregnancy? Ectopic pregnancy is a condition where a fertilized egg implants and grows outside the uterine cavity. The most common site is the fallopian tube, and that is what we refer to as tubal pregnancy. But an ectopic pregnancy can also occur in various other locations, such as the ovaries, the cervix, as well as the abdominal cavity. And as you may be aware, these locations are not suited for fetal development. So an ectopic pregnancy is a medical emergency requiring immediate intervention. So what then are the causes and risk factors for an ectopic pregnancy? So the various causes and risk factors include previous ectopic pregnancy, which will increase the likelihood of reoccurrence. We can also have conditions such as pelvic inflammatory disease, which is often caused by sexually transmitted infections like chlamydia or gonorrhea, leading to tubal scarring. We can also have previous pelvic or tubal surgeries, which can cause adhesions or narrowing of the tubes. We have conditions such as endometriosis, where there is tissue growth outside the uterus, which can lead to anatomical distortion, thereby leading to ectopic pregnancy. We can also have IUD use, intrauterine device insertions, causing an ectopic pregnancy. We can also have assisted reproductive techniques such as in vitro fertilization, which may increase the risk of improper implantation. We also have smoking, which can reduce fallopian tube motility and will increase the risk of implantation in the tube. So what then are the signs and symptoms? So the various signs and symptoms include a patient coming with a history of a missed period, what we call to amenorrhea. The patient can also present with vaginal bleeding, which can be light spotting to heavy bleeding. The patient can come in with abdominal or pelvic pain, and this in most cases is often unilateral and can be severe. The patient can also come in with shoulder pain, which is a sign of internal bleeding, irritating the diaphragm. They can also present with dizziness or fainting, which can suggest rupture and hemorrhagic shock. So those are just some of the signs and symptoms of an ectopic pregnancy. So what then are the complications of an ectopic pregnancy? So the various complications include rupture. This can lead to life-threatening hemorrhage if a rupture occurs. Another complication is the risk of infertility because there will be damage to reproductive organs, which may impair future fertility. There is also risk of recurrent ectopic pregnancies. So once an ectopic pregnancy occurs, the risk of recurrence increases. So this condition also can lead to emotional distress because there is loss of pregnancy, which can be psychologically challenging for the patient. So how can you prevent an ectopic pregnancy? So you have to treat sexually transmitted diseases early to prevent PID and tubal scarring. You also have to cease smoking to improve tubal function. You also have to visit your gynecologist for checkups, which will help in early detection of risk factors. So that was just a brief presentation on ectopic pregnancy. If you haven't yet liked or subscribed, please do so. Thank you.